Lyme disease is the topic for this video. And Lyme disease is something that happens to a lot of people who live in heavily wooded areas. I try to make these videos geographically independent, since people from all over the world are watching them, but this is one of those conditions that sort of is based in certain geographic regions. So let's talk a little bit about what's happening. You go into the woods and you get bit by a tick, and the type of tick that causes Lyme disease has a special name. It's called Exodus, whatever the pronunciation is. And there's different types, but this is the main name. And then what happens is this tick then transmits an organism into your body called a spirochete. And the name of the spirochete is Borrelia burgdorferi. And that's important to remember. So don't get confused. The tick's name is the Exodus tick, and the spirochete, which is the organism that the tick essentially introduces into your body, is called Borrelia burgdorferi. Then what happens is it involves the skin, because that's where the tick bite occurs. Eventually, this organism, the spirochete, the Borrelia, will enter into your lymphatic system, and later will disseminate into your bloodstream. And when that happens, that can cause systemic symptoms. So Lyme disease, essentially, if you have symptoms, there's three types of symptoms. They're localized, but they're also characterized by stage. So you have early localized, you have early disseminated, and then you have late. So early localized, which appears in 75% of patients, is really referring to that rash. And that rash has at the site of the tick bite has a special name. It's called erythema migrans. Erythema migrans. And I'll show you a picture of that rash. This is what it looks like. As you can clearly see, the area is a large area with a center and a periphery resembling a bullseye, if you can kind of see. And it can appear most commonly on the thigh or buttock or axilla. In this photo, it's actually on the back. So that's the first initial presentation. Once the organism, that spirochete, disseminates into the bloodstream, you can get systemic symptoms. And those are systemic symptoms that include malaise, fatigue, chills, fever, headache, and myalgias and arthralgias, which in layman's terms are muscle pain and joint pain. This will occur about 3 to 32 days after the tick bite, and this is a few weeks after the tick bite. And then also, in about 15% of patients in the early disseminated phase, you can also get neurologic symptoms like meningitis and Bell's palsy, facial palsy. That's important to remember. Alright, now we have the late stage. And this can happen years later if it's not treated. Months to years. We'll put months to years. And what is this late symptomatology? It involves arthritis. Severe arthritis, commonly affecting the knees. Alright, so how do you diagnose this? Well, the diagnosis is really a combination of history, where a person presents with a rash, with the classic history of exposure to an endemic area that's endemic to Lyme disease, history of a tick bite, and some of the classic initial symptoms. But then there are some blood tests that are done, and those blood tests are actually given us a very easy to remember name, Lyme titers, and those Lyme titers can come back to be helpful in the diagnosis. And that's all there is to it, really. Sometimes physicians can also do blood cultures, and then also you can do CSF cultures as well if you feel it's necessary. And also, since the knees are involved, the joints are involved, joint fluid can be tested, aspirated and tested. But really, the history and the Lyme titers usually are the way to diagnose it. Treatment. Well, the treatment of Lyme disease is involving antibiotics, most commonly doxycycline, but there's also amoxicillin and ceftriaxone. And then the arthritis is managed with non-steroidal anti-inflammatory drugs. All right, now I'd like to show a couple clinical vignettes about this disease. A 40-year-old woman vacationing is bitten by a tick. She does not seek medical treatment and eventually develops chronic arthritis of the knee and hip joints and paralysis of the left facial muscles. A physical exam during the early stages of the disorder would most likely have revealed. Well, this is a classic vignette. It's nice that they don't actually mention Lyme disease. It kind of makes you think, but the history is pretty classic with the tick and then the arthritis. And my opinion is she probably hasn't gotten treated for months to years, because the arthritis is actually, as you remember, it's a late presentation. So what they're asking you is, when she first had it, what would she have had? And it's actually right above you. She would have had that classic rash, which is known as erythema chronica migrans. And finally, we have a epidemiological question. Global eradication of Lyme disease is unlikely because, if you remember, there's a tick called Ixodes, and it transmits the spirochete, Borrelia burgdorferi, and the tick acts as a reservoir for that organism, and as a result, because the tick is endemic to certain geographic regions, Borrelia burgdorferi can be maintained in nature forever, pretty much, by this tick. So therefore, A, where it says Borrelia burgdorferi can be maintained in nature indefinitely by a tick vector, is the correct answer.